multiple other uses, and this just fits in for medical surge. So after other properties were looked at, we identified this one. I'd like to welcome up some people that have assisted us with this and throughout our healthcare community. First of all, it'll be Brian Brandman, Program Manager from Optum Health Services. Brian, thank you. Dr. Joe Corcoran, Chief Medical Officer, Sunrise Health. There you are. Thank you. Everybody's wearing a mask, so they're hiding from me, but I appreciate it. Bud Shaw, CEO, Kindred Hospitals. Thank you, sir. Vince Varelli, CEO, North Vista Hospital. Thank you, Vince. Bill Carone, Director, CEO, VA, Southern Nevada Healthcare Systems. Oh, there you are, Bill. Thank you. Mason Van Howling, CEO, University Medical Center, who will speak to you here in just a moment. Great to see you again. And Dr. Dan McBride, Chief Medical Officer of the Valley Health System. Thank you, Doc. And so this is to show this community that none of these are operating as individual businesses, but as one healthcare system that's there to help us through this emergency and to make sure that we are being able to provide the finest care possible throughout this COVID-19 emergency. And so they've come together with this plan. They're communicating every day throughout our emergency operations plan that we have intact. And we expect that to continue throughout this entire time. And it's going to take that type of collaborative effort for us to get back to normal and to get through this pandemic, excuse me. So with that, I'd like to go ahead and bring Steve Hill up. Steve is the CEO for the Las Vegas Convention and Visitors Authority. Steve, would you come on up, and I will socially distance myself away from the podium.
Thank you, Chief. I think I win the contest for the best looking mask. We're at the Convention Center are certainly happy to be a community partner and a small part, frankly, in this effort. And nothing would make us happier than to not have to use this facility. But as the Chief said, the Convention Center is a community resource. It is a place that the community has looked to respond to many things over the years, and this crisis is no exception. And I want to thank all of the ambassadors at the LVCVA for their work on this. But really more importantly and more pointedly, I would like to thank Chairwoman Kirkpatrick for her leadership of just an exceptional group of people who have come together in this community to respond to this crisis, to take care of the citizens of Southern Nevada. As I said, we're happy to be a small part of it, but the folks on the front line of this are really who should be getting our appreciation today. And I know I speak for everyone in Southern Nevada in thanking all of you and everyone who works with you for taking care of us. So I will end with those remarks. Again, thank you. We're happy to be a small part of any kind of assistance that we can bring. And with that, I would like to introduce Mason Van Howling, who's the CEO of UMC. Mason?
Good afternoon. I'm Mason Van Howling. I'm the Chief Executive Officer at University Medical Center, and just want to say our team at UMC takes great pride of working alongside our community hospital partners. We've got Brian Brenneman from Optum, we've got Valley Health System, we've got Dignity Health, we've got North Vista, Kindred, the Sunrise System, and the VA, and many others that are coming together to ensure Southern Nevada remains ready for any influx of patients. Well, we certainly hope that we do not use this site as needed, as Commissioner Kirkpatrick had mentioned. Our world-class healthcare team members remain ready to provide care and oversee the hospital operations at Las Vegas Convention Center. All of our hospital experts continue to work diligently alongside our partner organizations to prepare all the resources needed for this low-level acuity facility. With valuable guidance from our infectious disease specialists, nursing leaders, physicians, our logistical team members, Las Vegas hospitals will ensure community members receive the high quality care they deserve at this facility. If we do see a spike in our patient volumes at all these hospitals, the alternative care site will play an instrumental role in protecting hospital capacity and care for the community's most critically ill patients. I'd like to take a moment to thank all the organizations and individuals in the planning of this monumental task, and particularly Brian and Greg. You guys have been rock stars, so thank you for all the time and effort, 7 days a week, 24 hours, 7, in this planning process. We couldn't do it without you. So I've always seen Southern Nevada come together in healthcare crisis, and I remain confident that during this time we have the necessary expertise, resources, and most importantly, the dedication to overcome any challenges in our community. So with that, I'm going to introduce Dr. Logan and ask him to come up. He's our Chief Health Officer of Southern Nevada Health District. Dr. Logan?
Thank you, Mason. Okay. Good afternoon. My name is Fermin Logan, Acting Chief Health Officer, Southern Nevada Health District. I want to talk first about the data that we have up to today. There have been 2,509 cases reported in Southern Nevada, including 106 deaths. And I want to take this opportunity to also express our condolence to the families who lost their loved ones. I also want to say that today we started to post in our website zip code information. Those are maps showing where our cases have been reported, so you can see that. And also we are showing that information by the 5 jurisdictions of Southern Nevada. So it can be seen by zip codes and cities. Also, last week we start reporting the estimate number of patients who recovered. Since we are unable to fully follow up in each of those patients, we develop an algorithm to estimate that, and based on that estimate, we consider that today we have about 11,000 patients who recover from coronavirus in this community, which is about 45% of those cases. I also want to talk about community trends, because there have been a lot of questions to our staff about the trends, and also in the news. I have to say that at this point there is not any reliable information in terms of trends of whether the disease is going away or staying the same. What we can say is that we still need to be prepared. We still need to focus on social distancing and also all the respiratory hygiene and respiratory protection that we have been discussing. I also want to mention that our lab has been increasing its testing capacity in recent weeks, and the same has happened across the region. Today, there are several hospitals that are able to do in-house testing in Clark County, which is great for our response. And also, commercial labs are available for providers at primary care facilities. And also, there have been some initiative in drive-through testing at some locations here across the county. Still, testing is perhaps one of the biggest issues that we have right now, and it's something that we expect to be improving in the near future. I also want to mention that our staff are being collaborating with providers across this community, and also we have been participating and assisting shelter facilities, whether it is Catholic Charities, the Salvation Army, also with the staff at Cashman Center. We have been collaborating with them. We also have been collaborating with the state in the response to outbreaks at nursing homes and adult living facilities, which actually has become one of the biggest issues, probably one of the most concerning, because these are the age group that have the more severe presentation for coronavirus. But this is something that we have been collaborating with the state and doing their investigations and supporting with testing and other activities. I also want to remind everybody that, again, the most important thing today for us as individuals is to focus on in what we can do as a person, as an individual, and we have to emphasize social distancing, stay at home. If you are ill or you are concerned about having signs or symptoms of coronavirus or respiratory disease, we ask you to first call your medical provider and tell them about your signs and symptoms. Something that is happening across the country today is that telemedicine is becoming more accessible, and there are every day more providers offering that. Probably today, more than 50% of the providers are offering telemedicine, which actually is an opportunity for us to be seen by our provider at distance, and they will help you with the decision of what to do next. That also prevent us and many others from going to the emergency departments and just overcrowding those facilities, when actually the hospitals are being very busy with the severe presentation of coronavirus that we are experiencing here in this community and across the country. I also want to say that, as you know, the CDC in recent days came with a recommendation for using the facial clothing for protection, and this is something that is not as efficient as an N95 mask, but is something that helps us protect those around us. The N95 mask, as well as a surgical mask, the recommendation is to just make sure that are available for first responders and hospitals across the country. And having said that, I will ask Commissioner Kirkpatrick for questions.
Hey, I want to say thank you for everybody that came here today. This really is important that the public know that we are prepared, we are ready. But first and foremost, I want to thank county staff, because our county staff has done yeoman's work working around the clock to ensure that we still provide the social network that we need. So they're doing phenomenal work. Secondly, I want to thank the commissioners, because the commissioners have been working on all different facets to ensure that we will get through this, and the other electeds as well. That is one of the beauties of the multi-agency communication centers, because we come together in times of need, and we all fan out the work to ensure that across the board, all the I's are dotted, T's are crossed, so that we are prepared. And that's something that's near and dear to me, living in this community, because we have the community who comes together, we have business who comes together, we have all of the electeds in every single agency that ensures that the general public's public safety is number one. Third, I'd like to thank all of these gentlemen that are standing up here with me, because they work tirelessly, 24/7, they're on call, 24/7, they're answering calls, they're changing plans, priorities change. As we said to you, when we started this back in March, our priorities have changed tenfold, and every day we're navigating a new system. But I do want the general public to know that we are prepared. The part that you can do as a general public is please stay home if you don't need to go out. That is making a difference. It's making a difference in the sense that we're not spreading the virus around. Wearing the mask, that's important. I want to thank our grocery stores who have stepped up, who are now putting in new parameters for our grocery store folks. And I can tell you that on Sunday, it was nice to know that many people were just at home, taking a deep breath as we asked you last week. And we want to encourage you to do that. That is your part that you can do today that will make the biggest difference for all of us as we work through this. In the coming days, you'll hear that our recovery efforts, because we do have to start thinking about that today. What does that look like when we are able to get to that? So we'll continue to keep you abreast of what we're doing and let the general public know that we're working every day to ensure that your safety is number one and that we can all get back to some normalcy at some point. So what I would say now is if you want to ask questions, we'll invite the appropriate person up, but please repeat the question, whoever decides to answer it, just so that everybody knows what we have. So questions? Yes. Mason or Dr. Logan? Dr.
Can I invite Brian up?
Yep, Ryan.
Brian, would you mind taking that one? Because you do a lot of analysis on this.
Thanks, Mason. Get the softball right up. So, right now, I think we're seeing a little bit of a leveling off, but we're very closely watching because there is a lot of variation across the country with some states are kind of more mature into the outbreak than we are, and some states are kind of coming up towards their peak. We are watching very closely the number of admissions, the number of ICU admissions, particularly people on ventilators, for an indication of any movement upward that will signal in to need to surge. But for right now, we're very thankful. I think that, as the commissioner mentioned, staying home, protecting yourself, protecting your family is working. We need to be patient and keep our eye on the ball. And I think if we can maintain what we're doing right now, we're in a pretty steady state, and we're very comfortable with that.
Hi, the question was whether we felt social distancing was taking place on the major construction sites. The answer to that's yes. There have been some cases of coronavirus on some of those large projects. There has been no indication that I'm aware of where those cases have led to a spread as a result of that person being on the site. So I think that's indicative of the real exceptional measures that have been put in place at these sites. And I have some responsibility for both the convention center expansion and the stadium construction. So I'm aware of the measures that have been put in place. They are more stringent than just what has been recommended by the CDC and the health district. In both of those locations, there is a person in a senior position who is responsible only for the implementation of those protocols. Each of those sites have 6 people that work for that person who are there day and night to enforce those protocols. And I think the results that we've seen on those sites is indicative of that.
On this facility at the South Hall, and then at what point would you trigger, we need to put people in here?
So the question was, when would construction begin at the South Hall if needed? And then also, at what point would we go ahead and trigger putting people in there, correct? Thank you. And so the trigger for the construction is when we start taking a look at the surge numbers, and we believe that we will have to move some patients out to give some relief to the hospitals within 4 days, right? So 4 days is what we are taking a look at. Do we have a hard number as to what is in each one of the hospitals for that? Right now, we do not have that number available. What we do know is that we have the consultation with each one of the hospitals every day to say, what are your levels at, what are your needs, and what are your projected needs. And believe me, I'm a plan A, B, and C person, and so I'm going to be moving towards that as soon as there's any indication. Right now, our indication is keep them in our hospitals because the hospitals are working. And thank you, Chief, but we don't need that yet. And so that's the strategy moving forward as far as when we would go ahead and move forward. I'm going to let Mason speak to that one.
Sure. The question was, are we at the tipping point on the cusp of enacting our search facilities at the convention center? So we're always planning this all parallel, side by side. Every day, as Chief mentioned, we not only talk once, but multiple times a day we're in the room together. And we're constantly looking at our ICU beds, occupancy, our medical beds, occupancy, our ER beds, our ventilator use. So back to what Mr. Brenneman said, that the social distancing, all the CDC, the Southern Nevada Health District initiatives that we did early on, we canceled elective surgeries, the outpatients, we encouraged people to stay away from the hospitals unless it was absolutely necessary. I think we would all agree that it's had a huge impact on the acceleration of the cases here in Nevada, but also the hospitalizations, and allowed us, more and more testings coming on. Our treatments are getting much more aggressive, and so we're watching it every day, every hour. But we want to be prepared, and as we all mentioned, we want patients in the hospital. But if we need to, we're ready for this next step.
Dr. Logan.
So the question is about the value of antibody testing, right? Well, the antibody testing has value in terms of establishing the presence and behavior of the disease in the community. So like we can identify what segment of the population, what areas are more affected by the disease. In terms of management of the patient, is also useful, but to a lesser degree than the PCR, because the immune response to those tests, the way that it expresses is like the IgG, which is the acute phase of the infection, is only positive after at least 5 days from onset of infection. So that's kind of a delay, as opposed to the PCR that gives you immediate answer. So I guess that.
If I don't have any more questions, I'd encourage you to send residents and the general public to Channel 4. We have updated with some coronavirus PSAs, reminding people of different things that they can do. We've linked with the Southern Nevada Health District on our Channel 4. There's some great information out there on some things that you can do to do your part at home. And so we appreciate you coming out today, and definitely want to make the general public aware that we are prepared in the event that we would need it. But the number one goal is to hope that we don't need it. So thank you.
And that was an update from Clark County government officials here on the latest on the coronavirus here in Southern Nevada. Right now, we're also on standby waiting for an update from President Trump. But in the meantime, for right now, we'll return back to regular programming.